Hi, I'm Pamela Arora, the CEO of AAMI, and I'm here today at DHIS. This is Class's event for Digital Health Investment Symposium. And I'm joined today by one of the keynote speakers that was at the event, and he spoke today. And we have Jared Conley, who's a doctor in an emergency department. He's currently at Mass General Hospital and Harvard Medical School, and he's the Associate Director of Healthcare Transformation Lab. I really enjoyed your presentation. Jared shares the digital transformation of healthcare and really making a case for those innovations in hospital at home. Both have implications to our AAMI stakeholders. We have stakeholders in manufacturing, as well as service professionals for medical devices and software, sterilization, and HTM biomedical professionals in hospital and clinics, kind of taking care of that technical equipment in the hospital and clinic walls. In your presentation, you're talking about how that might look quite different when it goes into the home setting as well.
Yeah.
But you make this great quote in your presentation, and you're saying, only use the most expensive hotel in town when it is needed. Please share with the AAMI stakeholders what you mean by that.
Yeah, absolutely. At the end of the day, it's all about using the most expensive equipment or facilities only when they're needed. And so we've thought a lot about that for MRIs. We've thought about a lot about that for surgical suites, et cetera. But we haven't generally thought about that in the hospital setting. And there's actually some really good evidence developing and, frankly, long-standing showing that it's safe to actually deliver hospital-level care in the comfort and convenience of home for a pretty significant swath of who we currently hospitalize. And so ultimately what we're looking for is, you might have a heart failure exacerbation, and we can actually risk stratify you such that we can actually determine it is plenty safe for you to be home. Now, you still need all the stuff that we provide to the hospital, right? IV medications, monitoring patch perhaps, so we know your heart rate continuously, and other such things. But at the end of the day, there's a real opportunity to better make use of the hospital setting, especially as we're facing huge capacity crunches in many of our urban hospitals around the country. We need to better think about how we use that most expensive hotel in town. This also translates to post-surgical opportunities. And so, you might get your surgery in the OR, go to the PACU for a little while, and then when it's deemed to be safe, you actually might go home much earlier than you otherwise would have. So we're best using that.
A lot of people would like that. A lot of people would be far happier at home. I mentioned to Jared earlier, my 91-year-old dad, whenever he's in the hospital, he's trying to figure out how to break out.
Right, absolutely.
So that'll be well received by many. Excellent points. But when we look at how we're going to get there. Today, you already have patients at home. With the Mass General, you're already doing that. What does that look like today? How many hospital home visits do you have relative to the home setting?
Yeah, it's been a process of growing over time. We want to do this safely and effectively, and ultimately such that our patients are delighted with their experience. And frankly, they are. I think to your point about your father, we're averaging, it depends on the day across Mass General and Brigham, often in the 30s for average daily census. And we're looking to grow that significantly over the next couple of years. And ultimately, the goal is to actually reach an average daily census of 200 patients per day that are actually being hospitalized in the comfort and convenience of home while we still maintain all of the facilities that we have at Mass General Brigham.
That is fabulous. Well, as far as building that foundation, you mentioned that there's a good foundation in many hospital systems as far as what's in place. What do you see in place, and what are some of the gaps? Certainly, you're already demonstrating and closing those gaps with the care you're delivering in the homes today. But as far as what you're seeing in the hospital systems across the nation and globally, what is working and already in place, and what do we need to adjust?
Yeah, absolutely. So, there's been a lot of great digital health transformation happening over the last several years. I think the biggest opportunities that we see for improvement is on remote patient monitoring. I think there's been some good initial work there, but it's often required some point solutions to integrate or not integrate with our platform solutions. And then we're really seeing probably the biggest opportunity in the supply chain management. So as care moves to the home, whether it be chronic care, home infusions, or actually acute care, we really don't have yet the software chassis in place to allow for order entry to fulfillment like we do in the acute setting or in other settings that we're used to, where you can guarantee that a certain supply that you need is actually going to be delivered exactly when it's needed.
Good point, because it is complex and there's so many different needs.
Yeah.
Absolutely. In talking about the future of healthcare innovation and applying technology, you mentioned that clinicians need to take a leadership role. Explain how you see it working and what you'd like to see in the future.
Yeah, absolutely. So there's a real opportunity for clinicians to be co-designing with technologists. We really need each other, whether that's a software engineer or biomedical engineer, whoever it is. The biggest challenge, of course, is that is physician time, right? That there's a physician shortage across America. There's really a lot of patients that need to be seen. And so it's trying to carve out the right amount of time for those physicians that are interested to actually co-develop some of these products and services that could really allow for a much better experience of care with the use of technology.
I will offer that during COVID, many of our standard work groups were handled remotely, and now we have a hybrid during these working groups for whether it be standards or consensus reports. I'm hopeful that it'll be easier for clinicians to get engaged in some of those foundational approaches across the spectrum. So we need to make it easier for the clinicians to be involved, because it's hard to be away from the bedside. There's so many needs.
Yeah, well said.
At AAMI, we promote development, adoption, and applications of the standards that you and I have talked about and sharing best practices. Is there any area that you feel standards or even just education need to take place to really make this hospital at home a future reality?
Yeah, there's actually several areas, and I think there's a lot of opportunities to partner across stakeholders here. I think, there's an example, for instance, in remote patient monitoring, where we actually don't have, we have pretty good standards for traditional settings like the ICU and the medical ward, but we don't have standards in place for how some of that same technology could function most appropriately in the home setting. Right? One of the biggest things that we see is motion. Patients, when they're at home, they're more active, which is actually good for health and healing, but it can sometimes interfere with the physiologic monitoring that we're using, whether that technology is PPG or some other type of technology. And so there's a lot of opportunities to really work on standardization there, and also around kind of, who should actually be using that type of technology and who doesn't need it. So there's a wide swath of opportunities to think through which technology is indicated, how should it be functioning in the home, who does it apply to, and we're on a journey with several stakeholders, and I think a partnership with folks like AAMI and others would be a wonderful, wonderful opportunity.
Well, we would love that opportunity. Enjoyed your presentation. I think you really helped inspire a number of people in the audience. So thanks for what you do, and continue doing it and scaling it up, Jared. Beautiful Park City here. It's a great day. I feel very fortunate to be here and have this conversation. Thank you.
My pleasure. Thank you.